Welcome to you and your pets. I am Jim Horton, and we're here with our resident animal expert, Dr. Ernest Rogers of the Maplewood Animal Hospital. And we have a guest with us tonight, and the guest is...
Crystal. Crystal is one of my cats, and Crystal's a little bit of an older cat for today's show, and the theme of today's show
is older cats. And how old is Crystal, as roughly as you can tell?
Well, Crystal's been with me for 6 years, and I think she was probably 8 or 9 when she came in.
Oh,
so Crystal's got to be 15, 16, maybe even 17 years old.
Oh, so she is indeed a cat who's a little bit, shall we say, long in the tooth.
Exactly.
Let me ask, what is the average lifespan of a cat?
Well, unfortunately, I can't give you a timestamp, but I've seen cats as old as 20 and 21. Mm-hmm. I think the oldest cat I've ever seen was 23 years old, according to the owner. And then I'd say we start worrying about old age diseases between the ages of 6 and 9, and we follow them through until we have a diagnosis, and that often the kind of diseases we see that are prevalent amongst older cats happen around 12 to 15.
Okay. So in that regard, then, Crystal must be in the zone where you have to kind of keep a closer eye on her.
She is. And a lot of times there are symptoms, and sometimes those symptoms are misread by owners. So older cats do have their own special challenges, and I'd say any time from about 9 years old and on, we should be doing some preventative health things.
Okay. Well, before we get into the preventative health things, let me just ask a few more things about Crystal, since she seems to be, she's holding her own. She's doing well so far.
So far.
Hasn't decided she wants to get down yet.
We shouldn't mention that to her, though.
And if Crystal decides that she wants to travel or something else, we'll let her go and be put in her cage, and we'll keep talking. But where does she live?
Crystal lives with me at my veterinary clinic. As I say, this cat was brought in one of the first weeks that I was open. The owner no longer wanted it and said that the cat was blind and wanted to have it euthanized. And in the case where I examined the cat and I saw no real reason for euthanasia, the owner agreed to sign it over to me for no cost to her, and I've kept Crystal ever since. So Crystal's been with me for almost 7 years. It'll be 7 years this May.
Oh, that's very, very good. Okay, and Crystal, are you you're not paying, you're looking down, you're not paying attention.
Crystal isn't quite sure what all these lights are about. Crystal typically, as an old cat does, sleeps most of the day in the window and enjoys that kind of comfort. Mm-hmm. So this is a lot of excitement late at night.
Now, Crystal seems to have some eye problems. Are those something that she came with, or something that's just a matter of age that we're dealing with?
Well, no, it's not really a matter of age, but clearly the longer you live, the more likely you are to have an accident. And I suspect what happened to Crystal at some point in her life, before I got her, she had either a chemical burn on the eye or an infection. She may even have had that from a kitten that has clouded the cornea, or the glassy part, the front glassy part of the eye, through which you see the colored part of the eye. And once that is injured, veins and arteries grow through that, and it becomes cloudy, as it is in Crystal. Mm-hmm. And so if you can get a close-up of this, I'd be happy to have you see it. But this is a corneal problem that really is going to be with her for her entire life. She can see around it. Mm-hmm. She isn't completely blind, but she can't actually visualize things as easily as maybe you or I.
Okay. So she probably uses her smell and that to get around a lot more?
Typically, cats do use smell and ears to understand what their world is about. In fact, a very good friend of mine enucleated or took both eyes out of a cat, and the cat would still catch mice. So that shows you that though our eyes might be 90% of what we use, their eyes are less than that, and they can certainly use their more acute senses of hearing and smell to get around.
Okay. So now let's turn to the preventative care for an older cat. I know in a previous show we talked about the preventive care for younger cats.
Correct.
But what are we looking at over a typical year for an older cat like Crystal?
Well, I like to start, as I said, between 6 and 9 years, start taking blood on a regular basis. And by taking blood on a regular basis, I can look at the liver, the kidney, the chemicals they put out, other organs, and make sure that these are within normal guidelines for the age and for the type of cat we have. Clearly, if we're starting to see elevated enzymes or chemicals for the liver or kidneys, our eyes focus on that and our ears go up, and we try and take it the next year. And if it's a trend of increasing values, then we start worrying about potentially liver disease or kidney disease. There are other diseases that we can monitor for by doing blood work, and then clearly a yearly exam. Dental work is one of the more important areas that we consider in preventative health. Bad teeth can lead to bad heart, bad kidney, bad lungs, bad liver. So we like to do a lot of dental care when they're 8, 9, 10, before they get to the 18-year-old, where anesthesia becomes more of an issue than it is when they're 12.
Now, when you say dental care, is that care that you give, or is this something a householder does?
Well, I think certainly if there aren't too many people that can get their cat to cooperate when they want to brush their teeth, that can be a challenge. However, my dental care includes knocking the cat out and cleaning the teeth, going under the gums and taking the dental, it's called tartar, from under the gums, so that the gums are healthy. That's the most important thing in any animal, is that the gums are healthy. And if the gums are healthy, then we want to make sure the teeth are solid and have no infection in them, and cats can get caries or dental cavities. And so we want to make sure that that's all properly taken care of. And that's a very important part of the health of an animal.
I'm just curious, and this may be a very dumb question, but I'm going to ask it anyway. But does something like fluoride work with animals' teeth, or is that only with humans?
Fluoride, we do have certain preparations of fluoride that we can put on animals' teeth. Certainly that will help reinforce the enamel, but typically with what cats eat, and because they don't brush their teeth, it's generally not something we do every day. We do it when we clean the teeth. So that's very, very typical for us to have to do. We do use fluoride. We use other medications to help with the teeth, usually antibiotics. When we start seeing gum inflammation, which is also called gingivitis, and that's something that we often see in humans, we tend to arrest the bacteria in the mouth by giving antibiotics.
Okay.
The other thing we can use is, obviously, there are certain sprays that we can use in the mouth to help maintain a healthy dental profile.
But this is all stuff that really should be done by a veterinarian who can put the cat asleep long enough to get this done, so you don't end up with a scarred hand and
And a missing finger,
and
yes.
a missing finger, right?
Well, typically, I like to think that my clients come in and get consultation with me. We work hand in glove to maintain the health of the animal. In some cases, yes, I do have to do some of the preventative work. In other cases, we can sometimes get our clients to do some of the preventative work, mostly very rudimentary, as in putting a spray in the mouth or just making sure that the food is the right food. And often that makes a real big difference to the animal.
I want to go back to something you said earlier and ask you a little bit more about it. You said taking blood regularly. What did you mean by regularly? How often would you take blood on an older cat?
Very good question. I like to start around between 6 and 9 years. We take the first little bit of blood, and if everything's fine, then there's no need to worry any further. Until 2 years later, when we'll take another sample of blood and evaluate it again. If on the first sample we're starting to see some kidney values, in other words, the chemicals of the kidney or the heart or the lungs, if we start to see that increasing, then we might want to do it in 6 months to make sure that it's not a trend. And then again, if we have to and we see a trend starting, we might do it again at a year. So in 1 year, 1.5 years, we might take 3 samples, especially if we notice something that's a little bit odd. Otherwise, I like to do it every 2nd year. And that helps save the owner some money, but also keeps us abreast of any problems so that they don't crop up and become major financial insults to the owner.
In your view, how many owners of older cats really know or understand the preventive maintenance they should be doing on the animal?
Well, I think part of that falls on us as a veterinarian. We maybe don't always give the proper information to our clients about preventative care, and I'd say probably 50% falls on the owner, and in these hard financial times, it's sometimes very difficult to come up with an extra $200 for blood work, or maybe $200 to $400 for dental work. So I think most owners are aware, because they're aware of what they do for their children and for themselves. But I think in hard economic times, it's sometimes very difficult to take what looks like a healthy cat and evaluate them for certain diseases that you can't really be sure they have.
Now, is something like the food that the cat eats, can that also help the teeth? For example, some dog foods actually help clean the teeth. Is there older cat food that will help do that an owner could buy?
Again, a very good question. I don't think the foods are significantly different one from the other in terms of flavor, in terms of nutrients, but they can be different in terms of their effect on the teeth. Certain cats like certain foods, and unfortunately, if those foods are gumming or sticking to the teeth, then we like to have them go on to something harder, or we like to have them go on to something with less of a pH or a higher pH. And that will help maintain the health of the teeth and the mouth. Typically, the pH of the mouth and the chemicals in the mouth will determine how good or how bad your dental work is in the mouth. So lots of animals have really bad gums but good teeth, and other animals have good gums but really rotten teeth. And so we have to strike a balance so that we aren't getting the kind of food that's going to stick to the teeth and make them bad, or the kind of food that's going to stick to the teeth and go under the gum and make them bad. So there are differences with respect to food. And basically it's just canned food versus dry food. And then there are different kinds of prescription food that we can use to help a cat.
Let's take Crystal here. What kind of food is Crystal eating these days?
Crystal is eating a normal, mature adult food. It's not very expensive. I get it from Costco. And it seems to be doing her well. Her teeth are healthy, she's healthy, and she's happy. Occasionally, I give her half a can of food that she shares with her friend Charlie, who's a middle-aged cat. And that's about as often as she gets canned food. Not that canned food is bad, it's just for Crystal, it's not the right thing to have all the time. There are other issues along with dentistry that I worry about when we talk about food. And one of those issues is thyroid disease. Often we have clients who look at their cat and say, well, he's eating great. He's just eating all the time. He's always eating. And that can be an issue in and of itself. It's not a sign of health necessarily, but it could be a sign of thyroid disease. And so that's one of the things I just wanted to bring out. It's not the food, it's the cat, and it's the hormone that's made by the thyroid gland. And that can actually precipitate increased eating. And that can also, you see increased eating in the face of weight loss, and sometimes high blood pressure, which isn't diagnosed until you bring it into the veterinarian.
Okay, well, we have to take a break. So Crystal seems to have settled in very nicely, and that's good. So maybe we'll see Crystal after the break, and maybe she'll stay with us for the whole program. Meanwhile, we'll be back shortly. I'm Jim Horton with Dr. Ernest Rogers of the Maplewood Animal Hospital. We'll be right back.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
Welcome back to You and Your Pets. I'm Jim Horton. I'm here with our resident expert, Dr. Ernest Rogers of the Maplewood Animal Hospital, and we're talking about older cats. We had an earlier program where we talked about young cats, but today is the older cat. And our guest is Crystal, and Crystal has been behaving herself just superbly so far during this program. And so she's staying with us for the time being, and unless she decides, oops, maybe I spoke too soon. Crystal's looking at getting down, so we may end up putting Crystal back in her little box to sleep here shortly. Going back to food, before we move on from the issue of food, Do cats readily change from one food to another, or is that something that's very difficult to do? So if an older cat has a condition which requires a change of food, how does the owner do that? Is a cat as finicky as a dog on seeing new food, or what?
I think cats are probably more finicky, and a lot goes back to when they were kittens, how they were given food. If they were given every food under the sun, I suspect they tend to be more open to food when they're older. It is a challenge with any animal, just as it is with any child, to get them to eat certain things. We have a number of different prescription diets. Many of them come in different flavors, but do the same have the same medical goal as we'd expect. So we can generally find something that they're going to eat, whether it be in canned food or dry food. And we can generally find something that they're going to want to take. So yes, cats can be very finicky, and we have had situations where, despite the fact it's in the cat's best interest to eat a certain food, we can't get them to eat that certain food. And we try and do the best we can with that cat.
So what exactly should an owner do? I know with dog food, you're supposed to mix a little of the old and a little of the new, and then progressively phase out the old. Is that the exact same way with cats?
I think that's a reasonable way to do it with cats. The one thing with cats is being so fastidious. If you mix the two together and a cat really doesn't like the new one coming in, they might stop eating both. And then you have to find a third food that they're going to eat. So what I generally recommend people is give them two bowls, one of the old food, one of the new food, put them side by side, and then if you see that they eat the new food, then also mix it so that you avoid the rejection of both foods.
Okay. When do you start looking at the animal and saying to yourself, this animal has too many medical problems to have a comfort in life any longer? I mean, I realize that's a tough subject. That must be a very difficult subject for an owner. But is there a point where medically it's just better that the animal not continue?
I think there is, and that's always an individual discussion. It's based on finances, on the relationship the owner has with the animal, and then on the condition the animal has. There are many conditions that can look much worse than they are, and diabetes is one of those. I recently had a patient that unfortunately passed on, and it turned out that it had diabetes, but it wasn't the diabetes per se, but the pancreatitis that was associated with the diabetes that occurred. And that made it a very difficult case, and unfortunately he passed on. But I think, getting back to your specific question, there really is no sign. I know when a cat's in pain and we can't retract that pain, when a cat has cancer and we can't retract the cancer and we can't modify it. Those are the decisions that are very difficult to make, but that's when you sit down with your veterinarian who has a medical basis for his decision making, and the owners who have an emotional basis with the cat, and we try and come to the conclusion. And I find most clients are very, very willing to accept what I tell them in terms of longevity and prognosis, or the chance that the cat's going to get better, and the difficulties that the disease is going to present. And from there, we make a decision as to whether or not we should safely and comfortably put the cat to sleep so that it no longer feels any discomfort or any pain, or whether we want to try addressing the issues that the cat has.
When you're dealing with an older cat, are some medical procedures too difficult for them, for example, like surgery, something like that? Are they less tolerant of medical help at a certain age, or are they still pretty robust and can handle care that might be invasive, for example?
Well, I think we can really do anything we want with an older cat. Age is not a disease. And I hate to say that, and I'm saying it more and more as I get older, but age certainly is not a disease, and there's no reason why we can't help certain cats. I would prefer to do some invasive procedures, things like dentistries, or if the cat has to be neutered or spayed at a later age, or if they have lumps and bumps, I prefer to do it at 10 years old than 15 years old. But in general, our anesthesias are very, very safe. We have much upgraded monitoring. I use all electronic monitoring when they're under anesthesia. We know of problems many, many hours or many minutes before they are likely to cause any kind of harm to the cat. So yes, we can be sent for a loop because an older cat has unexpected reactions to certain things. But in general, I think we as veterinarians and as medical professionals are way ahead of the line, so we can treat older cats. But clearly, we would prefer to treat older cats when they're younger rather than when they're 23 years old. And it comes a point where if you're going to do a dentistry on a 20-year-old cat that may have another 3 to 5 years of life, is it worth putting him through that if it's not necessary? Just a routine dentistry. And I'd say in general, we probably would discuss that with the owner and come to a decision. But in my opinion, it would be a difficult decision to make.
Okay. I'd like to turn now to a completely different topic, and one that we discussed previously in relation to younger cats, but with older cats, behaviors. Some older cats, a few older cats of which I've had been around, seem to grow into almost eccentric behaviors the older they get. I mean, they're not. It's not the same as when they were young. They get sort of. They're like old codgers in a way.
They can be.
And is that just age, or is that just the relationship with the owner has changed over time and the cat's taking advantage of it, or something along that line?
Well, I think typically what it is, if you want to see a cat have a difficult time with behavior, move from one house where the cat has lived for 10 years to a new house where the cat is now trying to adapt. I think that can, shocks to the system can really make a difference. Having new people come into your family or people leave your family can be difficult for any pet, but particularly cats who have been sleeping with your son who is now 18 and going off to university. It can be difficult for the cat. Most cats can adapt fairly well, and I think their behavior is more a sense of lack of routine than it is Alzheimer's or cognitive dysfunction, we call it in animals. I have not seen cognitive dysfunction in a cat, but obviously the cat, having been brought up, will have different perceptions of things that happened around, and the older cat can usually sleep all day and be perfectly happy to see you and then go back to sleep and eat. So I find older cats are usually pretty good about getting along, and we see here Crystal's doing a wonderful job of just being good.
And she's got her eyes closed, so
she's purring.
She's purring, so she must have settled in. Oh, that's terrific. I remember I was asked to sit one cat, a particular cat once, who came in the house. We let the cat out of her cage, her little carrier. She shot up the stairs and she disappeared, and we tore the house apart and we could not find her. Finally, on a hunch, I went and looked in a deep bookcase, and sure enough, behind the books were two glittering eyes staring out at me. She found a place to hide, and by George, she wasn't going to come out until she was ready to come out. I'm assuming that when cats are introduced to new locales, it's their first reaction is to just get away from it. Is that correct?
Well, I find most of the cats that come into my office will climb to the highest point and look down. So what's going to happen? Now, in my office, I have many smells of dogs and other cats, so that's their protective spot. In a new house, and as I said, if you want to see cat behavior go awry, take them to a new house and let them go.
Which is what happened in my house.
Which is what happened in your house.
That's right.
And generally, within a couple of days, they start coming out, particularly if you leave food out for them and a kitty litter. My idea is to first, when a cat is in a new house, take them to where the food and the kitty litter is, put them in the kitty litter, and then just let them go. Eventually they'll come back. They might only eat at night, but if the people around them are people they're familiar with, and if there's no big dog or new cat or other animal around that they might have to contend with, then they usually come out of it and they start acting pretty reasonable and pretty normal within a week. So
it's a week of hell, and then things tend to settle down.
a week of not seeing the cat, more likely.
Yeah, I recall that situation rather well. Is there anything particular about older cats that owners should be aware of?
Yeah, I think I'm really concerned about any time an animal is losing weight. And the three big diseases we think of when an animal comes in losing weight, either losing weight, not eating, or having problems with vomition or diarrhea. The three big ones are thyroid disease, which in a cat's case is always hyper or high thyroid, kidney disease, which can happen over a lifetime of eating any food, and then finally diabetes mellitus, which is sugar diabetes, and we can see that in cats. Finally, cats with bad dentition, sore mouths can also stop eating. The difference is thyroid disease, they eat ravenously, and they always eat, and people think that they're doing fine until they go from being a 10-pound cat to a 5-pound cat, and that's a devastating disease. Kidney disease, and we can treat thyroid disease. Kidney disease we can slow down, but we can't reverse. And diabetes we can control, but we can't reverse. Certainly dental disease we can do something about. So those are the three big things, and I think the biggest sign is losing weight, vomition or vomiting, diarrhea, not eating, and those are the signs you look for in an older cat.
So basically, an owner should weigh the older cat once in a while?
I think when you feel your cat, and your cat's a 12-pound cat with good bone structure, you can feel the muscles. And then all of a sudden you pick him up and, I can feel more bones and he seems to be lighter. You can certainly weigh your cat if you have an accurate scale. There's no reason why you can't. But I don't think the average client owner is going to do that.
Okay. We've run out of time.
Oh, no.
So I want to thank you, and I want to thank Crystal, who is still purring, I guess.
Yes.
For being on the show tonight. And the next show we'll look again. I suspect we'll talk about forensic veterinary, the next show that we do. So this has been You and Your Pets with Dr. Ernest Rogers of the Maplewood Animal Hospital. I'm Jim Horton, and thank you very much for watching.